Hi, I'm Emily Lawler with MLive. I'm on the team that's been covering coronavirus and its impact here in Michigan. And one of the things we're hearing from a lot of readers and viewers here on Facebook as well is about how to deal with our mental health during a pretty unprecedented crisis like this in terms of public health. And to that end, we're very excited today to welcome Dr. L.A. Barlow. She's a clinical psychologist with the Detroit Medical Center and also has a private practice. So thanks so much for joining us, Dr. Barlow.
Thank you for having me.
Yeah. So I do want to say that anyone can submit questions. We'd love to have Dr. Barlow answer some of your individual questions. So there's a chat function there. If you pop some of those in, they will get to me and I will get them to her. So, Dr. Barlow, I wanted to start off with a general one first, which is it okay to feel anxious at a time like this?
It is very much okay. Actually, it's very normal. These are very unprecedented times. These are times that none of us have ever experienced before. So, feelings of anxiety is quite normal for this time.
And what kind of age demographics is this affecting? Who are you most seeing the most of this in, or most worried about right now?
This is actually affecting all age demographics because it is affecting them in many different ways. The children, it's affecting their typical routine of going to school. The adults, it's affecting them. Even the geriatrics are the older population. It affects everyone's normal routine and their normal daily living. So it affects all different age groups.
And how are you seeing people cope with this, or what are some effective methods that you've been recommending?
There's multiple different methods that I'm recommending. There's no set script for that. It would depend on what that person finds as an effective way of coping with times of stress. Animals are having pets are a great way of coping. Finding other things like finding a new home workout routine because I know the gyms are closed. So that's a factor that I'm hearing. People are used to getting into having the routine of going to the gym every day, going out to dinner. So what are some other ways that we can implement those type of things while we're being quarantined? Such as let's try different recipes or let's have a home gym routine. There's wonderful YouTube videos. I often highly recommend staying in touch with family members. We're in a wonderful age now where we can tap in, we can FaceTime, or we can talk to our different loved ones. This is a wonderful time to check in, to call them, to reach out to them and say, hey, how are you guys doing?
Yeah. What about in terms of things to avoid? Is there anything, is having the news on all the time helpful or hurtful at this point? Should you be saturating yourself with information about this virus? What are your recommendations there?
Absolutely not. It's important to stay informed about the latest developments, but turn it off. Find other ways of entertainment because it can become very overwhelming. And for children, that is also a problem because children, they hear it and they become frightened by hearing these things. And it's good for adults to say, okay, let's take a break from TV. Let's play a board game or let's do something else as a family. So it's important to turn off the TV because it can be very overwhelming.
And I have a question that's come in about a specific demographic here. How should recovering addicts deal with anxiety during this time?
I highly recommend recovering addicts or anyone that's experiencing overwhelming anxiety to reach out to their mental health provider. Mental health providers, we do provide telehealth services or telephone services in the event that you cannot get out and see someone in person. Also, there's wonderful virtual AA groups that I often recommend for people who are in recovery. Tap into those. Their virtual groups are a wonderful way of staying grounded and helping through this time.
And you mentioned children a little bit earlier when we were talking about the news. But what are some signs that parents should watch for that this might be stressing out their kids?
I highly recommend parents to keep the lines of communication open with their children. Allow kids to ask questions to kind of understand what are their concerns. If there's any change in behavior with children, such as bedwetting or just some unusual behavior that the children may be experiencing, then it's time to say, let's have a talk and see what are your concerns. Are there fears associated with what's going on? This is a big change of routine and pattern for children. A lot of them times they're used to going to extracurriculars or hanging out with their friends. So this is a big change for them. So it's oftentimes I recommend parents to talk to their kids, find ways to connect with them. If they're into video games, hey, let's play a video game together. Let's do a board game or something that, family time. It's important.
And one question coming in is actually about an 8-year-old. How do you help her when she's shutting down, refusing homework, and isolating herself?
First line would be to communicate with the 8-year-old and see if there are concerns associated with what's going on and kind of understand what the concerns are moving forward. If that is still a problem, I would recommend reaching out to a mental health professional and seeing if that could help through the process.
We talked a little bit before this chat began about some of the telehealth options that are available. How has your practice changed? Are you able to keep up relationships with patients digitally for the most part right now? And are other people also offering that as a service?
Yes, that is something that's widely offered right now, and I'm able to keep up with it either through telehealth services, which is like a video type of service, kind of what we're doing now, or either through telephone. And that is something we kind of chat about that earlier, that insurance companies are very lenient about that right now. They are allowing that type of service to be at the same cost or the same, whatever the insurance would provide. There's no additional cost for that type of service right now.
And I'm not sure if this question is coming in relation to children or adults dealing with this crisis. So maybe you could kind of take it from both sides. But how can you differentiate between normal stress responses and anxiety or depression reactions that would be a cause for concern?
The best way to differentiate would be, how is this affecting your normal daily functioning in terms of anxiety? And this is for children and adults. If there's a major change of routine, your adaptive functioning, such as, are you getting up every day? Are you taking a shower? Are you eating properly? Are you resting properly? If this is causing a major change in your normal way of functioning, daily functioning, then that is a cause for concern. And that's when I would highly suggest being evaluated by a mental health professional.
A lot of people are still working, including first responders and healthcare professionals. Obviously, as they're going to work, their physical health is being monitored. But what should they be doing to check in on their mental health as they're on the front lines of this crisis as well?
I recommend downtime, self-care time when you turn off the news and all of the different reports and saying, this is the time that I'm going to carve out to take care of myself, whether it's listening to music or whatever way it was best for that person to unwind, because it is an added level of stress for first responders and essential workers that must go out every day into this type of this timing.
So how important is it to maintain those social connections that we might have had before we were all staying in our homes for the most part? Even if those do have to take place in a different form, you can't necessarily head to go out to dinner with your family or go to the bar with your friends anymore.
It's very important to stay connected with individuals that are our families, our friends. I highly recommend. I hear of wonderful forums where people are doing like a group chat type of video call where people can get together as like a family on different, through different venues and say, hey, let's hang out together, let's talk. It's highly recommended that you stay connected with family. Even though we're quarantined and isolated, we can still reach out to our loved ones and we can still connect with them.
And we have a comment coming in that says, being isolated is very difficult for a suicide survivor. I can't even go see my mental health provider right now. For people who had underlying mental health struggles going into this, is there a chance that this situation is kind of exacerbating those? And what can people do to make sure they're checking in with themselves on those underlying pre-existing issues as well?
In addition to trying to reach out to your healthcare provider, through telehealth services or through phone sessions, see if your mental health provider will offer those services. Also, this is another time when reaching out to families would be very helpful to kind of help you through that time. If there's an underlying mental health condition, just reaching out to loved ones and saying, hey, can we just sit and talk for a little while? That often helps.
And this one is one that I know a lot of people will be having over the next couple weeks, likely as they head out of their homes. So, how do we overcome the anxiety that comes from having to go out and get household needs?
Taking into consideration the things that we know that will protect you from the virus, such as proper hand washing, taking those into consideration, saying these are the things that I can implement to remain healthy. Proper rest is another thing that we should always consider, as that's kind of a safeguard.
Yeah. In terms of proper rest, how important is it to keep a regular schedule, or as close as you can to a regular schedule, even if you're at home most of the day?
I do recommend keeping a regular schedule throughout the day, even waking up at the same time every day. I recommend that. Sometimes it's good to write down a to-do list. Use this time to say, you know what, this is a time that I can attack those to-do lists. Having a regular schedule, getting up every day, showering, getting dressed, even if you're around the house all day. Still, I recommend getting dressed every day.
And those are sort of the everyday actions. What recommendations do you have for people who are missing milestones? We've seen people have to cancel, baptisms, weddings, even funerals in some cases. And I know those are important to a lot of people.
Absolutely. Think of maybe creative ways either to celebrate this now through a virtual type of thing, or even planning for the future, saying, well, maybe in a month or two when this is over, we'll have another celebration, or we can really celebrate these milestones. That's another something to look forward to, is always a good route as well.
And I know that'll come up again with graduations. I'm not sure. I think some of the big universities have canceled theirs as well. But um, where can people turn for help if they feel the need to talk to someone? It sounds like you're saying that friends, family can all be a good frontline call, but finding a new healthcare provider for mental health can be difficult as well. Is there a good resource for that?
There is a good resource. Oftentimes, I suggest that you call your insurance, your mental health coverage under your insurance company. Ask for a list of referrals. The internet is another wonderful way of looking for a healthcare provider, a mental health care provider that you feel that would be a good fit for you.
One more question coming in. What are some good tips to combat general anxiety order during this crisis?
Some general tips is to try to maintain as much as possible your normal routine. That's a wonderful thing. Oftentimes, it is, even though we are quarantined, it is suggested that we still go out maybe an hour a day just to exercise. Exercise is another wonderful way to combat anxiety.
So I think a lot of people are dealing with right now not exactly knowing when the end is in sight here. That can feel like an overwhelming question sometimes.
And that can cause a lot of anxiety as well, because every day it's a different development, it's different information. That can cause a lot of anxiety as well, because we don't know the outcome at this point.
And is it sort of like we should be taking it one day at a time, or taking it in weeks or more manageable chunks?
Taking it one day at a time is recommended, because every day there are new developments, but minimizing that and say, okay, well, today, this is what we're dealing with today. However, look, what can I do on the positive side? What during this time on a daily basis?
Right. Long term, I think that some people are wondering if this will fundamentally change society in some different ways. If people will be more conscious about going to work when they're sick, for instance, or even shaking hands, maybe during cold and flu season. Do you see this having lasting effects? And is that something people should be thinking about right now?
It could be, but I believe in also looking forward and say, what positive long-term effects can this cause? Maybe it's changing a lifestyle, eating habits, or things like that. What can I take from this long-term that could be from the positive aspect? by using this time positively, maybe even discovering a new hobby or a new craft or something like that. Those are positive things that we can take from this.
One question from our audience here, and please continue to drop those in the feed. But this one says, my older son won't even go outside. He hasn't been out since it started, and he's convinced that it's in the air. Unfortunately, he's an older teenager and sees too much news, in my opinion. I tried keeping news and social media from him with no luck.
Okay, so I'm hearing that there is a conversation that the parent is having with the teenager. Keep those lines of communication open, and maybe even reach out to them and say, what about other things? Are you talking to your other friends? What about their social interactions and kind of their buddies? What are they talking about? Are they talking about the same thing? So and then also I highly recommend, if this is an ongoing concern, reach out to a mental health provider as well.
One more question from our viewers here is, should routine doctor visits be kept?
It depends on the doctor, that your routine your doctor's protocol within their office. Every doctor has their own protocol as far as routine appointments. I would reach out to your private doctor and ask what was their suggestions for that.
So as a kid at home in the summers, I remember being bored. I have not had that feeling as an adult until now. And I think a lot of people are kind of getting into that, like, what do I do with myself when there's nothing to do?
I often challenge my patients and say, what would you like to do with yourself? What are some things that you would like to do or enjoy do that maybe you didn't have the opportunity to do before because of your work schedule? What are some of the things that you've always thought, I'd really like to try this particular thing, but couldn't?
Yeah, that does sound like a good opportunity.
Absolutely.
Are there other silver linings you see coming out of this, the positives that people could pull out of this experience?
A positive is this is a wonderful time to connect with family. That's a wonderful positive. Or even older relatives that maybe you didn't have an opportunity to connect on a regular basis as you would now. So that's definitely a positive, reconnecting with family.
Yeah. And just a reminder that you can drop questions in that chat. But yeah, I wanted to talk a little bit too about just the signs of stress. Sometimes I think we get into this execution mode where we're just managing, we're dealing with what's coming in. Maybe we're not really fully processing things. But what are some signs that you can watch yourself for in terms of things that might clue you in that this is going beyond stress for you, that you might need to seek some professional help?
This is a time I often recommend taking an inventory of yourself, saying, how am I feeling? And how am I feeling emotionally, physically? How am I feeling right now? A time that you can really take inventory and say, is this situation stressing me out? Do I need to seek additional help for this? Self-inventory.
And I wanted to touch too on the importance of exercise. You talked about maybe finding a routine that you can do in your house. We can still go outside for exercise as well. Have you seen any cool, innovative ways that people are keeping physically fit and active while they're cooped up?
I have noticed a lot of wonderful, innovative ways. Fortunately, in Michigan right now, our weather is not so bad. So this is a great time to go outside and take a walk, kind of enjoy nature. If you have pets, take the pets out. Using what we have, the resources that we do have. We may not have all the wonderful gym equipment, but there are things around the house that we can use to kind of exercise and implement within our daily routine.
So since we don't have an end date for this, as we frame our thinking around how we're reacting to this global health pandemic, are we viewing this should we be viewing this as a new normal sort of, or is it more of a temporary situation and we should be preparing ourselves for re-entry at some point into the real normal, I guess, of 2 or 3 months ago?
I like the idea of just considering this as a temporary, but there are lasting effects, positive effects that we can take from it, as we spoke about the spending time with families, even implementing proper hand washing. These are wonderful things that we can go forward and say, this is a short-term situation, but what are the positive long-term effects that I can take from this?
And a lot of parents are asking about how to help their kids deal with this, which I know you've touched on a little bit. Um, what's the importance and what's the level really of structure you should have for your kids? They may be used to going to school between this hour and this hour every day. They might have some lower obligations on that end, maybe turning in virtually on certain days. But what structure should you really have in place for your kids?
Children usually strive better. They usually do better with some type of structure, saying, this is the time that we're going to spend time doing schoolwork. I often suggest having even a poster board up on the wall. Between these hours, we're going to have school time. Between these hours, you're going to have exercise time. Having structure is important to have some sort of normalcy within the child's life. I do recommend having structure.
I almost want that as an adult too. Now that you say that, I find myself, especially working from home, it's hard to differentiate between when work stops and ends because you're at the same
Yeah,
place the whole time.
yeah, structure is a great thing.
In terms of how medical health professionals are dealing with the stress of this, we talked a little bit about them being on the front lines. How do they balance that sense of, personal stress with the sense of professional obligation? Like, they have to be on the front lines to help everyone else, to help all of us who are getting sick.
I would recommend kind of categorizing it. Once you leave the front lines or the healthcare environment or the hospital, say, okay, I'm going to leave this here. But once I leave here, I'm going to go home and be a family person. I'm going to integrate with my family. I'm going to spend time with my family. It's important to kind of shut down and say, okay, that was there. That's my job. But home, this is my other part of my life that needs to be really, it's important for you to separate the two between work and home life.
And it occurs to me that we've been talking a lot about families, but are there any special considerations if you're living in an apartment alone by yourself, don't have a significant other, don't have a pet even? What are some steps that you could be taking?
There are others for that is a different type of population where single people who are living alone that do not have the family within the house. What other ways can you reach out to family or even friends? Friends can be a wonderful support group during this time. Are other ways of giving back. I've heard some wonderful ideas of people even making masks to kind of give back to the community.
Well, I appreciate your time on this. And before we wrap up, I did want to touch on one thing you mentioned is kind of the that there's no stigma and no shame of reaching out in a time like this. And I'm wondering if you
Absolutely.
could tell us a little bit more about that as we conclude this.
There's absolutely no stigma or shame to. I often tell individuals all the time, mental health is there. It's available. It is a covered option under most insurance policies. It is there. There's no reason to suffer. There's no need to suffer. If there is a mental health concern, just you might need someone to talk to, kind of somebody that's not outside of your family. That's what we're here for, to reach out, to give us a call.
Well, thanks so much. It's been great talking with you virtually today, and I hope that our readers and listeners can reach out to a mental health professional if they're feeling some of this anxiety that we've been talking about as well. So, thanks so much for your time today.
Thank you.